a practical guide. Uh, the agenda for today is I'll give a brief introduction to the JDN Planetary Health Working Group, our speakers, and then hand over to Carrie, who will moderate this session. The Junior Doctors Network was created at the 61st World Medical Association. It's an international platform for junior doctors to facilitate an open dialogue of global events and activities that are relevant to their postgrad training and the WMA. Junior doctors are defined as physicians within 10 years after their medical graduation. The purpose of the JDN is to empower young physicians to work together towards a healthier world through advocacy, education, and international collaboration. Various thematic working groups enable members to contribute to their subjects of interest and meaningfully engage in an ongoing discussion both within and beyond the World Medical Association. The Planetary Health Working Group in particular aims to increase engagement of junior doctors at the intersection of human health and the environment, taking a holistic approach which considers the climate crisis, global environmental changes, and also health equity. It's co-chaired by myself and Laura Young, and that's the Notion site in case you'd like to join us, which I'll share in chat as well. A brief introduction of our speaker and our moderator today. Dr. Carrie Lee is an infectious disease registrar and volunteers with Doctors for the Environment Australia as deputy convener of the Healthcare Sustainability Special Interest Group. She is a junior doctor based in Australia and a member of the WMA JDN Planetary Health Working Group. Our speaker today, Dr. Todd, is, welcome, Todd. He speaks and writes widely on the topic of how to accelerate environmental sustainability and climate change resilience in outpatient healthcare practices. He is clinical assistant professor at the H. Wardine College of Medicine, where his research focuses methods for teaching climate resilience. He's also editor and executive director of mygreendoctor.org, a free comprehensive guide to medical practice environmental sustainability, which is a joint project of the WMA, Florida Medical Association, and the FACP and Physicians for Social Responsibility. My Green Doctor is recommended by 32 health professional societies representing 41 million clinicians and practice managers. He has authored more than 20 policies on sustainability and climate change that have been adopted by the AMA and also other organizations. He serves on several nonprofit boards and is a past president of Physicians with Social Responsibility. He practices gastroenterology in Jacksonville, Florida. And thank you, everybody, and over to Carrie I'm going to stop sharing my screen. Over to Carrie to moderate. Thank you.
Okay.
Thank you. Thank you. And Todd, I'll hand over the reins to you. Thank you very much for the introduction from the JDN team.
Thank you. It's a delight to be with all of you. Thank you for the introduction. And I want to congratulate all of you who are here. Congratulate you for having a commitment to greening your practices. And whether you primarily work in an office or in a hospital, I think you're going to find really useful tips for engaging. I'm going to share screens here and see if I can get the slideshow to start. Yay, there it goes. All right. So topic is adding environmental sustainability and climate resilience to your clinical practice, whether you're in a clinic or a bureau or an office or even in a medical ward. I do want to thank the Junior Doctor Network for your strong work And those of you who helped organize today, Mauricio Murillo, who's doing our communications, Pablo Estrella, who's our president of the Junior Doctor Network, and then the key people put this together, Jesuel Ponce, Leica Rathod, Carrie Lee. Thank you so much. I also want to thank Clarice Delorme of the World Medical Association, and particular thanks to Otmar Kloiber, our chief executive for many, many years, who just retired a few days ago. Thank you, Otmar, for all your support of this work. You've already heard about me, so I'll keep going. Disclosures, that didn't happen. I have no financial interest in this talk today. You know, a better title for this talk might be Outpatient Healthcare, the Final Frontier for Environmental Sustainability in Healthcare. And I say final frontier because most of your hospitals are actually doing pretty good work engaging in environmental sustainability in the hospitals, working on saving energy, saving water, working on eliminating those climate warming anesthetic gases from the OR, thinking about waste around the hospital, including the operating room, trying to avoid single-use plastics, looking for more sustainable purchasing. But almost no one has turned any attention to the hundreds of clinics owned by hospitals and the millions of clinics around the country. And so I invite you to join this new movement to really address this final frontier, to take a look at our outpatient clinics and how can we improve them. Following this talk, I hope you'll understand the environmental and climate change impacts of our clinics, know the benefits of going green in our clinics, practices, medical bureau, surgical centers, to be aware of some of the climate regulatory challenges that are coming to our profession, to know what resources are available, both for greening our practices and for teaching our patients. And then a very important topic, how to be an effective leader in environmental sustainability in your clinical practice. You know, we're all so busy being great doctors. How do we find time for environmental sustainability? And I'm going to help you get a sense of that. Keep in mind the health threats of climate change and the imperative that humans abandon fossil fuels for energy generation soon, certainly within a few decades. And this is a picture from my town, Jacksonville, Florida, after a rather minor hurricane. And you can see both the financial but also emotional devastation faced by residents of these communities. And this is just a small part of what mankind faces around the world. I'm not going to dwell on the health impacts of climate change because I think you all know a bit about this, but on the left are the changes themselves leading to rising temperatures, rising sea levels, extreme weather events, heat events, rainstorms, hurricanes, tornadoes, flooding, droughts, and fires. And on the right are the health impacts that we need to be aware of as clinicians, but also need to be preparing our patients for: heat-related deaths, asthma and heart attacks, cancers from the emissions from fossil fuels, emotional illness, the emerging infectious diseases, malnutrition and famine, and of course, war and climate refugees as our species become stressed economically and socially by climate change. And healthcare is also a driver of climate change. You probably know that worldwide healthcare produces between 1% and 5% of the world's greenhouse gases. In the US, our industry is responsible for about 8.5% of American air toxic pollutants and greenhouse gases. About 405,000 life years are lost annually in the US from the air pollution as a result of the fossil fuels burned for the work we do. And in Europe, the number is more than 300,000 caused by Europe's air pollution from our industry. And millions of life years are lost worldwide. Our clinics are important as well. In the US, outpatient healthcare is responsible for about a quarter of healthcare's greenhouse gases. I think that's probably true in Europe and most countries as well. There are millions of healthcare offices worldwide, huge opportunities for us to save resources and save money. And I think just as important, we can influence the choices made by our patients. When they see us recycling, using energy wisely, and not throwing everything away, they will take some of those decisions home themselves. And we have a unique opportunity in our clinics, different from in the hospital, to prepare our patients, help them plan when they're living in a climate vulnerable community. So lots of opportunities in our clinics. Just want to talk a bit about scopes of greenhouse gases because you need to know this for the next slide. Scope 1 greenhouse gases, this is a definition by the U.S. Environmental Protection Agency that most countries now use when they track greenhouse gas production by industry or by healthcare. So Scope 1 emissions are the greenhouse gases resulting from on-site combustion of fossil fuels. Say we burn heating oil in a furnace to heat up the building, for example. Scope 2 greenhouse gases are those greenhouse gases that result from the electricity we buy for heating and cooling. So your electric bill reflects your Scope 2 greenhouse gas emissions. And Scope 3 emissions are from everything else, from products and services we purchase, product manufacturing, packaging, transportation, disposal, our own transportation to get to work. About 20% of greenhouse gases from healthcare are Scope 1 and 2, the remainder from Scope 3. Looking again at U.S. healthcare greenhouse gases by service type, and this is looking at Scope 1 and 2 emissions, you see again that hospital care is only about a third, 36% of the gases from our industry. Outpatient care is right behind there, 26%. And the other components you can read: construction, research, prescriptions, retirement, and nursing home care. And the point I want to make is if we don't think about our clinics, we're leaving behind a big opportunity for improvement. Now, the benefits of sustainability: it saves money by lowering overhead costs. In an American practice, we'll save about $1,500 per doctor per year by going green. We decrease uses of energy, water, chemicals, and other resources. This can improve the health systems and the clinic's reputation as an innovative leader. Sustainability meetings improve teamwork, staff morale. Our staff love to be involved in helping improve the health of the office and to improve the health of the community in this way. And of course, for clinician recruitment, our monthly newsletter this month highlights a physician in the Western United States who joined his practice because they have a sustainability program. So this is a way to recruit young, early career, community-minded professionals to practices. It enhances the patient experience, and we have data to show that, improves patient trust, creates a healthier office as we use chemicals, foods, and other products more wisely, keeping ahead of the regulators, which is a topic I'm going to talk about in a few minutes, and encouraging wise choices by patients and family with educational materials. And the bottom line, we can improve community health outcomes with our sustainability efforts. So I want to talk briefly about this topic you don't hear about much, which is using sustainability to keep ahead of the regulators. In the European Union now, there's going to be reporting of sustainability data by large firms, including in healthcare, beginning in January of 2028. That's the new CSRD standard. Countries like Singapore, Australia, and several other countries have similar reporting requirements coming. In the United States, our Securities and Exchange Commission reported new rules proposed in March of 2022. These were put on hold by our new administration, but they're going to come back. In New York City, there's reporting of greenhouse gases by commercial buildings. That began in 2024. California is requiring broad-based climate-related disclosures by large businesses, including in healthcare, this year. Several countries have pledged to net zero carbon emissions for healthcare in the coming decades, including ones in Europe, Africa, and in Asia. And the Joint Commission, an international certification organization, has this new Sustainable Healthcare Certificate program begun for hospitals 2 years ago. Again, only hospitals and voluntary, but it gives you a sense of what's coming. My conclusion is that regulators will make environmental sustainability part of our business models and all of our clinics eventually, whether it's 5 years or 10 years, I don't know. Clinics and private practices will need to develop expertise in environmental sustainability. And those practices that begin their journeys early, I think, will be less disrupted, happier, and more successful. And you don't need to wait. There are excellent management tools available now, which I'm going to share with you. Okay, we can improve our health outcome by teaching sustainability in our clinics. I'm just going to talk about that for a few minutes. Climate change poses a significant risk to our patients. Healthcare literacy on climate change is low in the community, and we as health professionals are trusted messengers. People listen to us and generally do what we ask them to do. Patients like receiving environmental sustainability information. We studied that in my research. Physicians and nurses in general report that teaching about climate change and health is important, but they're not teaching these concepts. And the primary reason that we read about in research is that, we as clinicians just don't have the time during the medical visit to talk about this additional topic. Well, there are good resources for teaching about this. These are all US-based resources. American College of Physicians has its climate change toolkit with nice handouts available in several languages. The American Public Health Association has some one-page fact sheets. AmeriCare's Foundation has also fact sheets as part of its climate resilience frontline toolkit. And we're going to post all these slides on the Junior Doctor Network, so you don't have to write all this down. And my organization, the My Green Doctor Foundation, has abundant resources both in English and in Spanish at mygreendoctor.org, and in Spanish, mygreendoctor.es. These are some of our brochures, our Healthy Home brochures that are available in multiple languages on a variety of topics. And we've actually done research on how to use these brochures. They're available in English and Spanish, Haitian Creole, and in a few weeks they'll be available in Mandarin as well. Our research was published last year in an important international journal. Our research was titled Heat Illness and Extreme Weather Health Literacy, Communication Preferences and Effectiveness for Patients Living in Climate Change Vulnerable Communities. And what we did is we went to primary care practices in climate vulnerable neighborhoods in the Miami, Florida area, and we asked patients to rate different types of educational tools that are available to clinics, brochures, one-page handouts, video screen messages, e-newsletter messages, and others. And what we found, this is data for our Surviving Extreme Heat brochure. The bars in blue represent I agree. And we asked patients if they're going to share the brochure with family members. Most people said yes. We asked if the brochure was too long. This is a 6-page trifold brochure. They said no. But most importantly, most people said they're going to make new decisions in the home because of reading the brochure. They found the brochures easy to read. They learned something new. And most importantly, 90% or more said they were glad their medical office provides this information. And that's important because a lot of physicians are hesitant to talk about environmental sustainability or climate change in their office, thinking it's going to be political and alienate or turn off their patients. And our study and others has shown that no matter what your political persuasion is, people like this information and they're grateful that it's shared. So go ahead. Our study's conclusion, the medical office waiting room appears to be an accepted, time-efficient, and effective site to communicate knowledge on climate change and health. So you don't have to do this work in your examination room with your patient. Use your office waiting room to share information on your video screens with one-page handouts or our brochures. Okay, greeting practices. What are the resources available? Well, if you're at a hospital, there are plenty of resources. Healthcare Without Harm is an international organization. They have a European branch, Healthcare Without Harm Europe, Healthcare Without Harm Global, which provides services in South America, Latin America, Australia, New Zealand, and in Africa. And they have their annual Clean Med meeting on many continents. So if you have a Clean Med near you, try to go one year. They have their Healthy Hospitals program as well. The American Hospital Association, the Joint Commission, there are abundant resources for hospitals dealing with using energy wisely, waste management, recycling, using packaging and plastics more wisely, greening the hospital supply chain, dealing with climate warming, anesthetic gases, employee transportation, and even climate advocacy that many hospitals are doing now. There are also resources for the clinic. The Royal College of General Practitioners has an excellent Green Impact for Health program with many wonderful modules. It's for primary care, and you have to be a member of the Royal College to access it. Canada's Green Office Toolkit is another excellent program. You don't have to be a member of a society to have access to it. The American College of Physicians has excellent resources available, handouts for patients, although you have to be a member of the ACP to use those. And then My Green Doctor, which is an open access resource available at mygreendoctor.org and in Spanish, as I said, at mygreendoctor.es. So I want to talk for a couple of minutes about how to be an effective leader in your practice or clinic. What roles should a clinician undertake in their practice? I want to talk about the WMAs, the World Medical Association's My Green Doctor, and how it can help your practice, and how to get started in your practice or practices if you're in a multi-practice organization. Just some general guidance. Some sustainability projects are managed best by practice managers and administrators, and others by clinicians. And I want to urge you to let managers be managers, and I'll show you what I mean by that in a moment, and let clinicians be clinicians. My second message is add sustainability gradually into clinic operations and into clinical decisions. We're all too busy already, is what I hear from managers and from doctors. So go slow and steady. Make a commitment to sustainability, but don't rush. I want to be something you can do forever, not just for a few weeks and then have to drop it out of exhaustion. And finally, include the entire clinic and practice staff. I often say when I talk to people to say no to green teams. So green team is when you take a couple of interested people in the clinic and they kind of go off and have pizza lunch together and make some plans for the clinic. My experience is that every green team fails. And they fail because, well, it's a small group and somebody can't show up, their clinic's running late, or they got to rush to the hospital, or they're away that day. And they just don't have the energy to sustain the process. Moreover, they're not bringing the whole clinic along. They're just doing some projects on their own without the leadership often of the clinic. So include sustainability in the staff meetings that everybody in the clinic attends, and bring on everyone along at once. I want to talk more about this sustainability, what I call division of labor. On the left are what I call operations decisions. These are processes in the clinic that are best led by the practice manager. Energy use, renewable energy, water use, uses of chemicals, purchasing, waste management, food choices, transportation choices, and teaching. These are generally operational decisions that are best led by the practice manager. On the right is a much shorter list, and these are decisions best led by the clinician, usually by the medical director of a practice or by an empowered clinician leader. I say empowered because if someone's going to step forward to do this, they need to have the authority of the medical director of the clinic to move ahead. AI is going to be an important tool for clinicians in managing environmental sustainability. The topics for the clinicians are on the right. Prescribing, so the right medication choice, nature therapy. You can imagine AI could be an excellent tool, for example, guiding a physician to the most environmentally and cost-effective choice for medication when they're prescribing. Medication disposal, which is a teaching function, medical testing, choosing the right test both for the patient and for the environment, right timing and avoiding duplication. Again, AI can help us enormously in being to look across a practice and see if our choices make sense. Choosing appointments. Is an appointment necessary? Could it be done by telemedicine instead of in person? Again, telemedicine saving resources. Referrals, are they necessary? Have we found the most cost-effective and maybe even environmentally effective person to refer to? And finally, teaching, urging that your clinic put brochures and handouts in the waiting room and be available for a communication if a patient does ask a question. So, looking back at this list, you see the left side has about 6 times more things, 6 times more projects than the right. And it's the left side, those operations decisions, that'll be best managed by the practice manager. So in summary, practice managers are best prepared to manage most of the practice's environmental sustainability program. But there is still a role for clinicians. Clinicians can be effective by encouraging and supporting their administrators and their practice managers to commit to sustainability. So if the director of your health system or the director of your clinic doesn't have a sustainability program, talk to that person and encourage them to get involved. Encourage use of proven resources, and I'm giving you several resources, My Green Doctor and others. Emphasize the financial and health benefits of an environmental sustainability program, and then be ready to lead the clinical decision-making initiatives and teaching processes. So when you find a group of clinicians in your clinic willing to work on these, to talk about best prescribing practices, best referral practices, providing teaching options. I want to give an example of probably the best study of the carbon footprint of primary care practices. This is a 2018 study from 10 primary care practices in Switzerland. And now on the left, you see what they call medical impacts, and that's those clinical things that we do. And on the right are the support functions in a clinic. And you can see that from a greenhouse gas standpoint, about 80% of the greenhouse gases come from these operational processes in the clinic, those things I had on the left in my division of labor slide. The green bars show the components of the greenhouse gas output of a clinic from transportation. And you see the transportation is more than half of the greenhouse gas impact of a practice. Staff getting to the clinic, patients getting to the clinic, and transporting supplies, and particularly medical specimens was a big factor in these clinics in Switzerland. So we want to encourage those practice managers to work on those support functions, on those operational functions, because that's where you're going to get the most bang for your buck in sustainability. Just want to talk for a moment about leadership beyond the clinic. We can share the successes of our clinics with the broader medical community and society. I don't expect you to do all of these, but to keep in mind the possibility of sharing what you've learned with your nearby clinics, maybe a clinic down the hall or down the street. Taking some of the ideas, the successes in our clinics, and sharing them with our hospital colleagues, our medical societies. If your county or state or national medical society doesn't have a sustainability program, doesn't have a program for providing information at the annual meetings or sharing resources online with colleagues, encourage them to do so. Our sports organizations, our social organizations, our religious organizations, each in their small way can be engaged in sustainability, maybe with recycling or using less single-use plastics, or maybe even by having information on their websites about how the members can benefit from sustainability. Our government organizations, so if you're interested in engaging in politics or going to public meetings, I encourage you to. And of course, in our own families, we can save money in the home and have a healthier family by taking home some of the things that we learn with sustainability in our clinics. Okay, last couple slides, I'm going to talk about My Green Doctor. This is a one practice management option. My Green Doctor is a free service provided to members of the World Medical Association by their members. So take advantage of this free service to green your practice and save money. This is a complete environmental sustainability practice management program. As I said, it's in English and in Spanish. We had more than 10,000 users in 2024 from 80 countries, and 32 medical organizations recommend My Green Doctor for managing environmental sustainability, including the World Medical Association, the American Medical Association, the Medical College of Physicians, and others. We're comprehensive, science-based, non-political, very easy to use. It works in any outpatient clinic, practice, or center. The key to success is the one-on-one coaching for practice managers. So I'm going to give you a QR code later to reach out to me to learn more about how you can access coaching. Your practice manager isn't going to be a sustainability expert or a tree hugger like me, so let us provide coaching to bring your manager along. And most practices are going to save money in the first couple of weeks using My Green Doctor. These are some of the 32 professional societies that endorse My Green Doctor. What makes it easy to use is the coaching combined with our meeting by meeting guide. This is a step-by-step guide which helps the practice manager know what to do each month. And it deals with the topics you'd expect: energy and water use, purchasing and waste management, proper uses of chemicals, transportation options, healthy food choices, healthy for the staff, healthy for the patients, healthy for the environment. We have a big emphasis on patient and staff teaching with a huge library of teaching tools. And of course, clinical practice decisions around prescribing, ordering tests, ordering follow-up visits. We're very supportive of those efforts. On the left, you see the Green Practice Pledge certificate that your practice will receive when you register at My Green Doctor. So go ahead and register, print that out, and kind of brag to your patients by posting this in the waiting room and in the break room for your colleagues. And when you complete our stage 1 program, which takes about 8 months, you get this fancier certificate, our stage 1 Culture of Sustainability Green Practice Recognition Certificate. This is from a practice in Western Canada that earned the certificate last year. And your patients are going to love seeing this in your waiting room. So go ahead and move forward and earn your own green practice recognition certificate. Again, free from the World Medical Association for you as a member. Okay, almost done here. Getting started. It's pretty easy. Register at mygreendoctor.org with the discount code MGDWMA, MGDWMA, and I want you to register as as a partner society member using that discount code. So register as a partner society member with that discount code. Ask your practice manager or administrator to commit to environmental sustainability using My Green Doctor or some of the other resources that I provided. Plan to make small, steady improvements in your practice. When your practice manager meets with us, she or he is going to learn that we're only asking her to add 5 minutes of My Green Doctor to each monthly staff meeting. Just 5 minutes. We've learned the hard way that if you ask for an hour, we're not going to get it done. And even 10 minutes is too much for a busy manager. But 5 minutes every month, month after month, year after year, you'll make dramatic improvements, something you'll be very proud of. Provide your patients with brochures, posters, and other teaching tips, particularly in the waiting room, and commit to qualifying for that Green Practice Recognition Certificate, which is free for you from the World Medical Association once you've earned it. Okay, and always emphasize the benefits of sustainability when you're talking to managers and your colleagues. You're going to save money, improve teamwork, staff morale, and clinician recruitment, enhance the visit experience for patients, improve the public relations profile and patient trust, create a healthier office, keep ahead of those regulators, encourage wise choices by patients and family, and improve community health. So keep reiterating these for your administrators. Bring them along with this process. Those are our goals for today. Most importantly, for you to know how to be an effective leader of environmental sustainability and climate resilience in your clinical practice. And with that, I want to thank you for helping our clinics and practices go green. This is a QR code you can use to reach me and to schedule a visit to talk about greening your practice. I'm going to leave the QR code there for a moment. And now I want to introduce our discussion leader, Dr. Carrie Lee. Dr. Lee is an infectious disease registrar and a volunteer with Doctors for the Environment in Australia. Dr. Lee, Carrie is a member of the World Medical Association Junior Doctor Network's Planetary Health Working Group. And I'm a little pitch here for the working group. These are just remarkable professionals working together to make a difference. So I encourage you to also join the working group. With that, I'm going to stop slide sharing and turn over to Carrie. So I get my
Thank you very much, Todd, for that very comprehensive discussion. I particularly liked the call for integrating sustainability into our business as usual rather than siloing it to the side. And certainly, I think there's a lot of opportunities where sustainability can be integrated no matter what area of medicine you're in, where you're practicing. I'm aware that we have junior doctor colleagues from all around the world working in very different and varied environments and practices in different resource settings. So I'd be really interested to hear from the experiences of participants online. If you feel comfortable to raise your hand if you have any questions or would like to share your experience, or add into the chat what has been the impact of climate change on your local practice or facility, and whether you've had any experiences or challenges in terms of integrating sustainability into your local practice. To kickstart, I'll bring us back to the first question around where to begin. So as mentioned, there's a multitude of opportunities and places to begin, both clinical and non-clinical. For someone who's starting out and making those first steps in terms of incorporating sustainability into their practice, what do you think would be top 3 priority areas, particularly perhaps some low-hanging fruits?
Well, I'm not going to talk immediately about the low-hanging fruit. I want to talk first about getting your practice committed. Talking to the managers, the owners of your practice, and getting them to agree that sustainability is going to become part of what we do in our clinic, that it'll be on the agenda of every meeting, every staff meeting in a small way, and we're going to really make a difference slowly, but over the long run. To me, it's about changing the culture of healthcare, starting one clinic at a time, so that whether you're a clerk or a nurse or an IT person or a physician, that you know that this is something that you do. I want sustainability to be one of our core values in a clinic, as important as respecting everyone who comes into the building, respecting everyone's privacy, and giving great health care, also environmental sustainability. Now, that being said, I would go to our meeting by meeting guide at mygreendoctor.org, which has sustainability broken out into very, very simple steps. That truly 5-minute aliquots. So we ask the practice manager, with your leadership perhaps, to work on those one by one. If there's something that isn't relevant to your practice, you can skip to the next project. But just go slowly, use the meeting by meeting guide for your first 10 months, and then go to our workbooks. We'll have another 120 things you can do. And we'll help guide you. Our sustainability team will help guide you if you need some support along the way.
Thank you for that. Definitely agree with the calls for building the culture to begin with. Now, in terms of some of the challenges and the barriers, and it'd be interesting as well if we could include some discussion or include the participants as well in terms of low-income country settings. What kind of challenges might occur in terms of taking these steps to incorporate sustainability into healthcare, and how might we overcome those barriers?
In low-income countries?
Yeah, I think we could to kind of comment on general. No, it's not always very reproducible, but then if we can also just comment on low-income countries as well.
Yeah. I wonder if there's someone from a low-income country on the Zoom today who'd like to sort of tell us why they asked that question and what their concerns are. That might be it'd be a fun way to start. We're a small group, so we can be casual in that way. Who asked that question? Would you like to turn off your mic?
Certainly, if you're comfortable, feel free to turn on your camera, or we've got someone, Ronnie Rivera, who asked the question. Or perhaps if you have some more information that you, perhaps a challenge yourself that you might have faced, but otherwise we could start with that discussion. And if someone else wants to join in, please feel free to put up your hand or turn on your camera.
Hi,
Yeah,
can
go
you
ahead.
hear me?
Thank you. Yes, we can.
Okay, I'm from Honduras, and some of the challenges here that we don't have a lot of equipment, money, or facilities to be to become more sustainable.
Yeah, and so in some ways you're probably already conserving resources desperately, kind of to keep the lights on. But this is a situation where your patients may be particularly vulnerable to the impacts of climate change, and and saving energy is probably something you're already doing. So our energy modules, which are so important in highly developed countries, aren't as relevant to you. You're already saving energy. You're already being extremely careful. You're turning off the lights. However, you also have probably a highly climate vulnerable population. So I would use your energies to on the education side to communicate with the patients, whether it's brochures or maybe video screens in the waiting room, or just having a short conversation with your patients so that you know that they understand heat-related illness and how to protect themselves. People who work outdoors and work hard outdoors, people who may have homes that aren't well insulated, people who may have less access to healthy foods. Talk to them about healthy foods. Being aware of the risk of extreme weather, flooding, tornadoes. Does your family understand their risks, and do they have a plan to escape if they need to? So maybe turn to those educational tools as a really important part of your own sustainability program. Renewable energy is another topic where a clinic can really benefit. Being dependent upon the grid in a less developed country is really a challenge. So maybe look for ways to include renewable energy. Get a grant for solar panels, perhaps, for your practice. That may be another way where climate resilience can be very important. We didn't talk about climate resilience itself. How is your clinic vulnerable to flooding, extreme heat, extreme weather events? That's another topic we didn't talk about. Maybe those are helpful ideas.
Yeah, there's also the WHO Alliance for Transformative Healthcare in Climate and Health, ATTACH. So if you're part of a health professional association, then you can join a WHO ATTACH, or your country may also be a party to that as well. And that can be a useful forum for resource sharing in terms of strategies for the health system itself to become more environmentally sustainable. And I'm aware that a lot of junior doctors with the WMA are already very involved with climate-related advocacy on a broader level, and certainly advocating for those points as discussed, and highlighting the health co-benefits as well could be really beneficial. So thank you so much for sharing that, and certainly would be really interested to hear from other participants if they feel comfortable to share their experiences, either examples or solutions as well. We have many leaders from our LMIC colleagues, and also potentially challenges too. So I might steer the conversation more to how can junior doctors be involved. So I guess as a junior doctor myself and with everyone else online, we might experience certain power differentials perhaps, or we might be caught up in on the ground clinical work. But how can junior doctors be more engaged, more involved, be more allied with senior clinicians and other members of our health facilities when it comes to sustainability?
Yeah, the World Medical Association has already adopted really wonderful policies on climate change and health. So I don't think the organization itself needs to be told, hey, do more. But your national medical societies really do. And WMA has access to great resources that are on WMA's website, that are in our newsletters, but they're not getting down to our national medical societies. So if you're in Honduras or the United States or West Germany or India, try to get your own medical societies to take advantage of the resources that WMA is providing for free for them. So that's a way you can really get involved and make a difference. Yeah.
Yeah, certainly. And I think from my personal experience, I think sometimes junior doctors are maybe more literate when it comes to climate health risks and strategies, and also have an opportunity to open a conversation with our senior colleagues. You might be seeing patients that have presentations that might be related to environmental risks such as heat stroke or cardiovascular disease or air pollution. And that could be a good starting point to begin a discussion around the impacts of climate change and health. And certainly if you're working in a high income setting, there's a lot of opportunities around reducing unnecessary interventions, and in any setting, preventative healthcare and investment in primary healthcare is certainly another opportunity. So how do we? Oh yeah, go on. Sorry.
One more. I've seen over and over again how impactful junior doctors can be at our medical societies. When you show up at your annual meetings or your specialty society meetings and you speak up and say, hey, we want this. We want continuing education on climate change and health. We want opportunities to do research in this topic so we can have a profession within our academic centers emphasizing climate change and health and developing expertise. When you speak up and ask for it, those old folks are going to listen. So take advantage of your power as a young leader. I really wish you would, and I'm happy to help any way I can.
Thank you. We really appreciate that. The follow-up question. Where can junior doctors receive resources and funds to do this work with, for example, awareness, education, capacity building initiatives? And again, what are potential low-lying fruits that junior doctors can already take advantage of?
Sure. There are plenty of people who come and talk in your medical centers, for example. If you have a grand rounds program in your department, I can get you access to experts who will come talk to you about heat-related illness or the risks of climate change in general. So maybe it's have a grand rounds once a year in your hospital or in your department. That's one way. So CME, continuing education, is a great way to bring our colleagues along, help organize that.
Certainly, I also had experience helping to co-host a grand rounds as a junior doctor. That's something very accessible that we can do. Any awareness raising within your departmental meetings, journal clubs, or are great opportunities to do that. I'm not sure if there's any particular funds or resourcing that you might be aware of.
No, but there are a lot of people who come and talk for free. So particularly if your department has access to Zoom and can broadcast at a meeting, there are many organizations, including WMA and many environmental organizations, we're happy to provide speakers who would do that for free. So it doesn't have to be expensive.
Great, thank you. I'd be interested to talk a bit more about how we converse with patients around climate change, and if you have any personal anecdotes or experiences, or from your research as you've touched upon, be really interesting to learn a bit more about that.
Yeah, so we directed most of our research to the waiting room simply because we know that doctors are too busy to do this in the clinic. There is one physician in Michigan, the United States, who has a 40-second speech on climate change and health he gives to every patient for 40 seconds. And that's very well received. He did surveys with patients, Republicans, Democrats, older, younger. They liked his speech, but you just can't ask doctors and nurses to do that. We're too busy. So I encourage the waiting room. But on the other hand, in our research, about 30% of patients would like to talk to their doctor about the climate change risks that they face in the family. So even if we don't have time to step forward and talk to every patient about this, we need to educate ourselves so that when they ask us, oh, should I be worried about heat illness, doctor, with my cardiac problem? Or should I be worried about the foods I eat with my diabetes? And the foods we eat have an implication for the environment as well as for the health of the patient. Or do I need to worry about where I live in terms of climate risks? Educate yourself, be able to talk for a few minutes with your patients to teach them. Use that opportunity.
Great, thanks for that.
There are other options too. We can put information in that printout that most patients are given when they go home. You can put a short note on climate and health there, or tell them resources to go to on a very hot day. There are little messages one can put there, but the waiting room is a great place to leave materials or leave QR codes to give access to materials.
Yeah, and touching on one of your other slides where you mentioned about taking the message beyond the waiting room as well into the community, it'd be, I think that's a great place as well to deliver climate and health education, perhaps in schools or churches or other health awareness days, if that's already happening, in terms of an NCD day or a heart awareness day, just incorporating some degree of message in there around climate change risk too. We've got another comment from one of our participants suggesting that for sustainability in low-income settings to focus on waste management as well, and a comment about reducing high levels of waste hierarchy, so avoidance rather than recycling, for example. Prevention is important. I definitely agree with that comment. Avoiding single-use disposables where possible as well. I don't know if you want to comment more on waste management and recycling.
Well, until recently in the United States, most hospitals burned their plastic waste on site, which is a terrible source of dioxins and other toxins for the air and the community around the hospital. Check that your hospital or your clinic, make sure they're not burning on site. And if they are, really, that's a terrible, terrible injury to the neighborhood. So that's one place to look at your waste. When I was a kid, we used to reuse needles. We reused all our gowns. We need to go back to reusing things and not throwing everything away. And sometimes it means going to the suppliers and saying, no, we're not going to buy disposable anymore. We want things we can reuse, and please manufacture them and supply them to us.
Absolutely. There's a lot of evidence around the environmental and the cost savings associated with reusable materials, whether it's gowns or other devices, and also being conscious about some of the I guess the conflicting pressures of commercial companies, perhaps, when they may be encouraging single use where reusable may be just as good, if not better. I've got another question here. How can political advocacy, locally or nationally, play a role in improving access to better food systems, for example, cardiometabolic diseases, and thinking about further environmental and health benefits.
Yeah. So My Green Doctor is not an advocacy organization, but I have belonged to many advocacy organizations, and if you're willing to step forward, I would really encourage that. The one I represent is Physicians for Social Responsibility, but in your community, there'll be others as well, even through your National Medical Association, potentially. You, as a physician, have a voice that the average citizen doesn't have. So when you go to community meetings and talk about the need for better parks and cleaner water and access to renewable energy and patient preparation for extreme heat days and flooding. When you as a physician talk about this, people listen to you. So should you have the bandwidth in your life to do some of that advocacy work, you'll find advocacy organizations in your community, wherever you're in the world, that will support you, encourage you, and would love to have a clinician, a doctor step forward to help represent their cause. So yeah, if you're willing to, and even run for office. When physicians run for office, they often win, and they can be very, very effective because they speak with such authority.
Yeah, certainly. And I think starting from where we are as well, sometimes local examples and subnational examples can be really powerful tools in terms of in terms of advocating for greater systems changes. So if you're working within a health system or within your local council area in terms of encouraging more healthy and better food systems, then that can be used as a powerful example and message in terms of spreading that beyond your community to the wider environment. So I think we're coming up to our last few minutes here. It's been a really interesting discussion so far. And if there's any final questions, we've probably got time for one more. But I guess at this point in time, I'm just reflecting on, I guess, the role of junior doctors, and particularly across high as well as lower middle income settings, and some of these questions around the gaps in terms of that practical implementation in a resource limited setting, and maybe what we can do as junior doctors as part of the JDN and WMA in terms of furthering that conversation and resources. But do you have any, I guess, final messages or wrapping up points, Todd, that you'd like to share with our group?
Well, I do. Look around at where you work and be sure there's some environmental sustainability program there to help your work environment. If you're in a hospital, your hospital administrator should join Health Without Harm and take advantage of their really money saving as well as climate saving resources for greening the hospital. But in your own clinic, talk to your practice manager. Think about bringing My Dream Doctor, which WMA gives you for free, and make it part of the things your clinic does. Take these ideas home to your families, and just whatever your stage in your career and your or life is, find some way to make environmental sustainability part of your life.
Thank you very much for that. I think we're right on 11 o'clock. Some very powerful messages. Thank you so much for your time, for sharing your resources and your wisdom. And thank you also to Leka, to the JDN team for organizing this webinar, and to all of our participants for joining us today. It's been a
Thank
really
you,
great
Carrie.
discussion.
Carrie, you're a wonderful moderator. Really enjoyed this conversation.
You too. Thanks, everyone. Have a
Thank
good
you.
evening and morning, wherever you are.
Thank you.
Bye.